can the American healthcare system be remodeled to look more like what they have in the Netherlands, where people seem to get care in a timely manner? And also, of course, for me as a public health person, I would like to see a lot more funding going into preventive care and health education so that people are more empowered to prevent stuff before it starts, including moral injury.
Right. So I think that is not a simple question, because you're asking for a change in our culture. Mm-hmm. We are asking for, in the preventative care, in theory, everybody agrees with that. In practice, it's much harder to get people to engage in prevention. And it's also, that becomes a social question with all the social determinants of health. So it is ideally, yes, we would do all of that. But I think that in reality, it's not going to be as simple as just saying, okay, we're going to have Medicare for all, and that's going to solve all our problems. Right. Because Medicare for all will still, we will still struggle with resourcing. It is not going to miraculously cover everything. There will be very difficult decisions that we'll have to make. And if we don't align incentives from all of the stakeholders in the direction of getting the patient what they need and allowing physicians to have the conversation about what the patient needs, what their goals are, what their values are, that, we're going to end up with very much a similar system to what we have now and similar frustrations.
Yeah, it does seem hopeless sometimes. I mean, I have moments of close to despair, and thinking how this country will ever have a better system.
I'm not hopeless.
That's good.
I'm not hopeless. I am seeing people who are understanding both what needs to change in the system and also who have a way of reframing the system and the challenges in a way that makes them seem solvable. But I think in reality, we all need to get more curious about why is healthcare the way it is, and what can we do about it. And I think we all get caught up in the idea that because it's structured a certain way right now, it has to stay structured that way. So, for example, the electronic health record is required, and so it takes as long to document as it does to see the patient,
or longer,
right?
Sometimes, yeah.
But we're all like, well, that's the way it is with the EHR, and in reality, maybe there's a different way to do it, right? Maybe we don't have to require all of the fields that are right now required. Maybe we can streamline the process. Maybe we can ask other people to input, or, I just think that we need to start getting more creative about how we look at all of the problems, not just the EHR.
Sure.
Hang on.
Sure.
Right, off you go.
So cute.
Okay.
Yes. And yeah, between the medical records and the billing, the accounts receivable management, which is integrated with the actual medical record, that's a whole other career field. I mean, people have whole careers just doing that. So, correct. Wow. So it certainly, talking to you, I do feel more hopeful. Again, because we have the words, we have the languaging, and I want to help put this concept out there and start more conversation about it, because it's people's lives depend on it. It's correct. It's I don't know if saying it's an invisible killer is being too dramatic, but I do think that besides the, you hear of successful people committing suicide.
Mhm.
They just hit that place where they just can't go on. That would be the most extreme example of moral injury, where the person suffering it ends their own life. But also, how many patients' lives may be put at risk because there just wasn't enough time to ask enough questions to get that critical piece of information that opened up a whole new door of understanding what the patient's situation is.
Correct. I think there are for sure, physicians have the second highest, one of the highest rates of suicide in all the professions.
Wow.
Nurses are quite high as well. And so it's clear that this field, there are a lot of reasons for that, but it's clear that the field is a it's a tough place to be. As far as patient risk and patient safety, when a team is morally injured or burned out and struggling to stay engaged, which is, the depersonalization piece of burnout. When you're struggling to stay engaged, your teamwork isn't as good. Eventually, patient care may suffer. But the other thing that I've seen is that people just don't have the same fire in their belly to get patients the care they need because they have seen too many times when it doesn't work. And they're kind of at a learned helplessness stage where it doesn't matter what I do. This is not going to work out. So why should I put that effort in?
The ratio of effort to results is so skewed. It's easy to I understand that. So, wow. Very interesting. What would you want more people to understand about moral injury? Just kind of as a final question. What are the next steps that we can do together, both health professionals and non-health professionals, to really get our arms around this issue?
I think we need to come together. I think we need to start working together. So across the licensing groups in healthcare and hand in hand with our patients, we need to all say, this is unacceptable. This isn't the kind of healthcare that we want. There are, we're trying to organize people together. You can visit our website, which is fixmoralinjury.org. There you can sign up for the email list to be able to follow along. You can, if you're a healthcare provider, you can take the survey. We have a moral injury survey. And there are all kinds of resources in terms of what we've written, what the writings that we felt are interesting for other people so that you can learn more about it. And in the coming months, we hope to have some live events like workshops to help people understand it better and start coming together, organizing to take action.
That would be great. That would be great.
And I will say that there are some amazing places like the New York City Council. Their hospital oversight committee recognized that moral injury in their emergency rooms may be one of the causes of some safety concerns they have.
Sure.
And so they raised that as a question.
That's important. That's important. I guess my final question would be, and maybe we don't have time to get into this too much. This might be a different conversation, but in the city of Mount Vernon, New York, there are 4 cities in Westchester County. All the other places are villages and towns. And so Mount Vernon is situated between New Rochelle and Yonkers, and each city has in excess of 50,000 population. Mount Vernon is officially around 70, but probably more like 100. We'll see what the census reveals. But there's one hospital. Mount Vernon is 4.4 miles total, and it's had a hospital for decades. And Montefiore bought it when it was on the verge of, it was in bankruptcy. And so Montefiore turned it around, but they announced last year that they are going to close the hospital and build a brand new facility farther south, in the south side. And it's an acute care, like, response center, but there will be no inpatient. And people are really, really angry about this. There are groups rallying to save the hospital and keep it open. But I'm just starting to do research on the trends. That the trend is to move away from inpatient as much as possible, and even have people self-care with the drainage tubes post-surgical at home. So I'm kind of wondering how all that fits into the moral injury, because people are getting jobs elsewhere because they know the hospital is closing. So how long can a hospital really stay viable when the team is just transferring out left and right? It leaves more burden on the ones remaining behind, and I really don't see how they can do their job with a less than adequate staff. So I'm just wondering what kind of moral injury is going on right now in that situation.
I don't know, because I haven't talked to the people at Montefiore,
Yeah,
or at the Mount Vernon Hospital. I can imagine they feel stuck between a rock and a hard place.
Yeah.
That they want to continue serving the community. They worry about what will happen if they leave. And yet they know that the care that they're providing may not be up to the standard that they would like it to be, or that it is up to the standard that they would like, but they worry that any minute it might not be.
Right.
And so, that's a very, very difficult place to be in. I can't answer the question about the business framework.
Sure.
That is a very difficult problem that is happening all across the country.
Yes, I've noticed that's a bit of a trend. So I'm just thinking that might be adding to kind of insult to injury, so to speak. So
I think the other, as we were talking earlier, there has to be, at some point, there needs to be a cultural shift, and we'll have to wrestle with what kind of, how do we provide the care that we want to provide?
Mm-hmm.
Are there limits on that care? But also, are there limits on the profits that we're willing to make in healthcare? And at some point, do nonprofits have, does everybody who's in healthcare have some obligation to serve the mission ahead of the profits?
Yeah. Yeah, I understand there has to be financial viability. Correct. So there, you've got to be responsible there, but yeah.
But it's also difficult when there's $1 billion construction project happening and not a nurse to take care of the patient in the emergency room.
Mm-hmm. Right. Interesting stuff.
Right.
What's do you have any final takeaway that you'd like to make sure you get on?
No, I want to make sure that people feel like this isn't, I really don't think that this is hopeless. I think it will require collective action to change, but that all of us have a role in it. So there's room for everyone.
I'll be getting on your website, and I'll share the link on my website, and we'll start, putting the word out. And if you have sometime, maybe check your calendar. I'd like to invite you to be on my live radio show, which is every Tuesday between 10 and 11. If you possibly have that time slot available. Otherwise, I can try to play parts of this interview on air, if that's okay with you. So thank you so much, Dr. Dean. It's really been interesting and helpful talking with you. And the problem is much worse than I thought it was. Even even as I resonated with it, it is going to take everybody. I see what you mean. So I'll do what I can to join the team and help make it easier for people as they work to save other people's lives. So truly cool. Thank you so much. Have a good day, and we'll be in touch, and I might send you some follow-up questions, and just for the written version of this.
Sure. Sounds good.
And so nice to meet you.
It's good to meet you too.
Thank you for everything you're doing. It's great work.
Thank you.
Very important stuff.
Thank you.
All right. Have a good day.
Okay, take care.